Hi, my name is Melissa Kelleher. I'm a licensed clinical social worker at Loom Fertility, and May is Mental Health Awareness Month, so I wanted to talk to you a little bit about taking care of your mental health as you're going through your fertility treatment. A lot of times going through fertility treatment is just inherently stressful for our patients, so trying to be as proactive as possible with your mental health just as you are with your physical health, because you really don't want to wait until you're struggling emotionally. If you can, you want to be able to think about a plan ahead of time so that if you're overwhelmed or kind of struggling with the process, that you kind of have your go-tos that you've already kind of thought about and that work for you. So my suggestion is to make a toolbox of coping skills that you can always kind of go back to as you go through this process. So you don't have to reinvent the wheel. There might be some things that already work for you, whether it be exercise, having that person that you're able to talk to that it really is helpful to you, or you may have to come up with some new ones that really help you get through this time in your life. So some suggestions for putting things in your toolbox. Some easy ones are really just simple breathing techniques that will really bring your stress level down to baseline, which not only helps you mentally, it helps you physically. And there's just so many apps out there that are easy to use and are quick to use, and you can bring them anywhere. One is called Calm. There's Happy Not Perfect. There's a lot of different ones out there that are really just simple to use. You can build a physical toolbox where you can have things in there like a stress ball, photos of people or things that make you happy, written notes to yourself that also can make you feel better. Another example are positive affirmations, so that when you're feeling sort of in that negative space, you can redirect and do these positive affirmations, and those can really help you bring you up and make you feel better. And also making a list of your support people. Who do you go to when you're feeling stressed, and who are really helpful to you. So the most, thinking about like putting those things ahead of time, writing them down, so that when you're feeling stressed, you don't have to think about it. You don't have to think about, well, who do I go to? What are the things that I like, that make me feel better? They're right there. You have those ahead of time. So listen, the bottom line is there's no one way to kind of deal emotionally, but the important thing is to try to be as proactive as possible, and that, by doing these things, it will help you get through the fertility treatment in the best way that you can.